explore groundbreaking therapy studied in goats to potentially reduce cervical disc reherniation. What's this about? Some pretty exciting stuff is coming out of the VA Medical Center, and it is being studied in goats. There is a patent that is being worked on, and the exciting thing is that when we talk about herniations of discs, we're going to talk specifically about the neck because that's all it's being studied in right now, but I'll tell about some potential implications for the low back, which is more common, but the neck. Once we have a disc herniation, we have the option for conservative management, or more frequently, if people are having severe symptoms, like their arms are going numb, they're getting some radiation of numbness and tingling, they're dropping items, they and their surgeon decide for them to have a microdiscectomy. That is when the disc herniation is shaved off. This can be more minimally invasive, but unfortunately, this often leads to reherniation because it's not like we've patched the disc. We've merely taken that little nubbin off, and there's still then a raw area of the disc that had been a hole where the herniation can reoccur in the future. So the exciting new technology is called a Tarp. That's a tension activated repair patch, TARP. It may help lead to healing of that herniated disc by the recent study, which was published in Science Translational Medicine in 2023, late last year. But now I'm having patients ask me about it, so I wanted to bring it to your attention. So the Tarp works by literally putting a little tarp around that herniation, and that supports the building of tension around the disc, which then re-cushions the vertebra. It doesn't allow continued dripping or leakage of the disc down into the spinal column. And they've embedded the patch, the Tarp patch, with anakinra, ANAKINRA. So this is a biologic. It's an anti-inflammatory biologic, so we talk about how cool is that to have anti-inflammation, and it's an interleukin-1 receptor antagonist. We normally have anakinra. It is released through our own natural movement, and it may aid in recovery, but the patch is impregnated with that. So they're looking at, particularly in the younger patient where this is not a degenerative herniation, but maybe you've had a whiplash injury in your neck, whiplash, and all of a sudden you have a herniation of a disc here in the cervical spine, that placing that patch right over the little herniated disc, whatever level that is, with the anakinra impregnated within it, that you may then prevent reherniation. It's going to kind of tether that and create a patch, literally. So the exciting thing is that if they can move this through into the human model, then they may be able to bring it down into the lumbar spine. So we're going to bring the lumbar spine back into play here. This little red nubbin simulates a herniated disc in the lumbar spine. So imagine that there are obviously some changes that need to occur to that. There may be some different tension-related issues with the placement of the patch, the size of the patch, etc., because these discs are a lot bigger. Look at the size of a lumbar disc versus the size of a cervical disc. So teeny weeny little things versus these are big boys. So same thing, same concept though. If we have a microdiscectomy, they shave off that little red jujube right here. Then we have a hole still that can potentially reherniate with a new injury. So we're hoping to reduce then the continued leakage of the disc, leakage of the disc, leakage of the disc. It's like flattening a tire over time that then allows the bones to become closer in relation to each other. That then closes off the area here, makes it more likely that you're going to come into contact with nerve rootlets which come down into your legs. And eventually, when people have more of that bone on bone because there's no disc space left, that leads to fusion and other permanent replacement surgeries where they put hardware, screws and plates in the spine. So we're trying to look ahead. I think it's really exciting that Dr. Harvey Smith at the Corporal Michael J. Christen's VA Medical Center in Philadelphia and his team are working toward. Wanted to be the first to let you know that there might be some things coming down the pipe for these cervical disc herniations, and then maybe even further down the pipe on lumbar disc herniations. So we do think the researchers, as well as the ability to use animal modeling in this. If you have any questions, please comment below, subscribe, like, and if you have any questions, your question may turn into a topic of the next video. Have a great day.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.